All right, so I'll introduce Nancy. I actually had the pleasure of having them do a presentation for one of the groups that I attended. So when we were talking about the topics, I thought, who better than Nancy? So I'll just read her short bio before turning it over to her. Nancy Mullen is the Executive Director of Youth Outlook, the first not-for-profit organization serving lesbian, gay, bisexual, trans, and non-binary youth, and working to increase understanding of LGBT youth issues in DuPage, Kane, Whiteside, LaSalle, DeKalb, Will, and suburban Cook counties in Illinois. Nancy is in her 25th year at Youth Outlook, coming to the agency when it was only 6 months old. A transplant to the Midwest, Nancy holds a Master of Social Work degree from Syracuse University, where she focused on family mental health. Away from Youth Outlook and the world of social work, Nancy is 10 credits away from a culinary degree to become a pastry chef, and published her first book, Urban Tide Pool, in 2020, and has her second book underway. She accepts community education and professional development requests through both Youth Outlook and Tide Pool Communications, LLC. So welcome, Nancy, and take it away.
Thank you, Delilah. Good morning, everyone. I'm going to add to all of what was just walked through. So working Youth Outlook is my full-time position. This has been where I have dedicated my career. The pastry chef thing was kind of a lark where I was looking to do something other than social work for a little while, and I fell into cooking classes, and I had a great time at Elgin Community College. I do a lot of live storytelling. You can probably tell from the way I move through our slides today that I do enjoy storytelling. I consider myself just a tall leprechaun in a way, going about the day telling tales to people. Released my first book, Urban Tide Pool. It's a memoir. It's carrying 5 stars on Amazon right now, and it was truly a labor of love to put that out there in the world. I'm a wedding officiant. I'm not a minister, I'm not an MDiv, I'm not a doctor of theology, but I am the signer of the papers and the sayer of the words for the folks who ask me. And I'm a dog dad. That's my little guy, Duncan, right there. So that's me in a nutshell. I consider myself just your average office boy on any given day. But let's talk about that introduction. Right, you heard my formal bio, you heard how I introduced myself. If I were standing in a Youth Outlook drop-in center, I would be more likely to go very informal and just start with, hey everybody, I'm Nancy. I work for Youth Outlook and I use pronouns interchangeably, please. For me, that means if you're addressing me in the feminine, Nancy, she, her is fine. If you're addressing me in the masculine, I have a nickname, Nando, and it's Nando, he, him. I picked that up while I was traveling in Italy, when my Italian tour guide wanted to call me a nunziata for a week, and I told her if she called me a nunziata for an entire week, I'd probably throw myself under a bus. So they settled on Nando, and it stuck. It came home with me. My friends call me that. My board of directors call me that. Some of our kids call me that. So please feel free to use either. And I default really easily today, as you can see in the name on the little grid. How about you all? For purposes of your introduction, have you started putting your pronouns in your email signatures, on your business cards, on any name badges or name tags that you wear? And if you would, I'm not going to ask you to come off mute because folks tend to hate that. But if you would just drop your name and your pronouns in the chat, that would be great. He, him, she, her, they, them, or what is specific to you. And please introduce yourself so that I can take a peek when I stop speaking. I'm sure y'all know each other for quite a while now. All right, so Youth Outlook, all of those things that was just read about Youth Outlook and all of the stuff that you heard me talking about before we officially started the recording section of this, all of those things are true. I would add one more county to what was read. We're now in Peoria on Monday evenings, and we are the first and the longest running agency that's working only with LGBT kids. So we came together as a not-for-profit to do just this. There are other organizations in the state for sure that work with LGBT kids. They are often housed in either a larger healthcare system or a larger mental health system, at least around here. I'm in the collar counties, where the services are one additional thing that agency offers. We came together only to do that. And we've grown a little bit and added a couple of extra things that we do, but our work is always, the focus point is always the safety and the security of our LGBT youth. I also found out recently, we think, we have good reason to believe, that we're the only organization like us in the country. And this kind of blew my mind because I've been doing this for a really long time, and it never occurred to me to reach out to some of my colleagues and say, hey, who does this in this matter? Does anybody else look like us? So we're an entirely virtual agency. We work across 8 different counties now. And we, I'm sorry, we're in 8 different counties right now, so we're covering an enormous area of the state. And what I found out was there are other organizations that cover a county or a city or maybe 2, but nobody's doing it across as large an area and fully virtual. Most of the other organizations have some kind of bricks and mortar that they go to, either their own or they've rented or they're in borrowed space somewhere. So we're kind of a weird little animal, Youth Outlook is. And I have to tell you, I'm exceptionally proud of this weird little animal right now. So let's keep moving. What do? We have the drop-in centers. That's what we're best known for. That's every week in one of our locations. And you heard the list, so there's a lot of them. There's about 16 different programs running every single week, mostly youth drop-in centers. We have 2 virtual programs for folks that can't drive or are too far away, so they can still access our service. And then every Friday we have a text-based group, which is something we partnered with another organization to be able to provide, and we're using their platform for it. So we now have a group that doesn't even require a Zoom camera. You don't need to be on camera. This is all text-based, and we'll come in and chat. We do 2 of those on Friday afternoon and Friday evening. So the other thing that we're doing right now, chewing up a lot of our time, and you'll see why as we move through the slides, is there's a lot of community education and professional development going on around this topic. The schools are trying to get their hands around it. Mental health providers are trying to get their hands around it. So we have moved away from doing a lot of, like I'm here for an hour today. When we do school trainings, we won't even do for an hour because there's so much that we need to impart to them that an hour doesn't give us enough time. So when we work with the schools, we're asking for multiple hours, and we now have a training product that is directed to not just one school, but entire districts. And working from the top down, working with the administrators all the way through the faculty, through the counselors, to the paraprofessionals that are working in the classrooms, to the bus drivers, to the cafeteria folks, everybody that we can get in on this. It's a multi-hour, multi-session training that we've put together called Road to Truly Inclusive Schools. So there's a lot of this work going on because, as has been observed already, the demand for services for LGBT kids is climbing right now. So for us, our work is mostly with youth 12 through 20. We have a virtual group for folks up to 24. Our kids are all over the map in terms of coming out and how they come out and whether or not they're out and how they've decided to identify what they want to use as their title, if they want to use an identifier at all. Not all of them do. So that's what's happening with the groups for the kids. We also have a parent group that grew out of serving our trans kids, because our parents were at a time driving sometimes up to 2 hours to bring their child to Naperville, which is where it was set up when it first started. And they were coming from Janesville, Wisconsin. We had somebody coming from Valpo. People were driving quite a distance to get to the group because it was the only trans drop-in center around the area. And they weren't going to go home. So we'd look out the door and there'd be a group of parents, huddled in their cars under their dome lights or on their phone with their Starbucks cup. And it's getting cold. It's cold in Illinois. So as it got colder, it was like, got to break up the parent tailgate, bring those people in. We're going to make them coffee and give them a place to sit. And that became our parent group. It was a very organic start. The group that we didn't see coming that we're now also very proud of is we have a grandparent group. I never thought Youth Outlook would run a grandparent group. We are not the grandparent service agency. We are the youth agency. And we got contacted about a year and a half ago by an assisted living facility because a group of residents had all experienced a grandchild coming out as trans or non-binary around the same time. And they went to their activity director in the building and said, hey, we'd like a speaker on this. Can you bring somebody in? She knew us from another thing that we had done together. And she came and got us and said, would you do a presentation? And I thought it was going to be a one-off. Like, we're going to visit these really cool grandparents and then we're going to go home and they're going to think about it and the world is going to be fabulous. Well, we did it and it was fabulous, except they asked us to come back. And then they asked us to come back. Would you come back once a month? Would you be able to do a group? Could you please come back once a month and hang out with us? Because we really want to practice this and we really don't want to do anything to offend our grandchildren and we don't want to do anything that's hurtful. And we ended up doing a monthly group with this group of grandparents in this assisted living facility, which was like the exact opposite of everything I thought Youth Outlook was ever going to do, but it has turned out to be a really wonderful addition to our services. And we will go as long as they will continue to invite us back. We're in our second year over there this year. Our work today, we're going to talk a little bit about terminology quickly. I would talk about the current national trends that we're facing because it's definitely affecting health and mental health. And I want to talk about some challenges to medical care that we're seeing, and then some tips for affirming practices for working with LGBT clients or patients. First rule of training with Nando, same thing as it is in a drop-in center. What is said here stays here, what is learned here leaves here. Please, please, please take it back to the hive, take it back to your social circles, your professional circles, whatever you can glean from this, please do take it with you. And if not everything works for you, that's fine. Take with you what works for you. And then there's one last kind of rule that I don't usually put in writing. If I tell you a bad dad joke, which I am prone to do, please repeat it and tell me later on social media how it goes, because I live for that stuff. All right, let's keep going. All right, so we've already hinted at the fact that language is evolving very, very quickly. Our language has become more nuanced over the last decade around LGBT issues than I ever dreamed it would be when we first started Youth Outlook and started working with teenagers. So our kids have become crystal clear on several points. They understand that their sexual identity is about their biology, and they know that that is dictated. The identity is dictated by what happens when a baby rolls onto the planet and the doctor holds the baby up and says, oh, you have a boy, you have a girl, right? They got that. So that's about biology, that's sexual identity. They're also super clear about gender identity, and it's not the same as sexual identity, and they are particular about it not being conflated. So gender identity is the identity that happens in your own head about your experience being masculine or feminine or somewhere in between, somewhere in that range. That's how you think and feel and relate to the world, and how you want the world to think and feel about you, and how the world relates to you, the expectations that are put on you, the stereotypes that you're expected to put up with, the roles that you're expected to take. So gender identity and sexual identity, two very different things. Our kids are crystal clear about this. The other stuff that they're really clear about is those two things should never be confused with sexual orientation, which is about how you are attracted to other people. That's about other people over there. It's not about what's going on necessarily in your head and how you see your own gender. Then the fourth piece of things that they are real clear about and like to have long conversations about, our kids will bend your ear for hours if you will give them an audience to do this, is talking about gender expression and presentation. How you show yourself to the world. How your hair is, whether or not you're wearing makeup, whether or not you're wearing jewelry, what you do with your clothing. So how you want the world to see you, and whether or not those match either your gender identity or your sexual identity. So our kids will talk about these topics forever when they come to the drop-in center. We have lots and lots of programming around this. Often they come in and they're already very educated about these. They've done a lot of their own research, so they can speak very knowledgeably about these. I usually tell teachers when we do presentations at the schools, this is one of the topics. The kids don't mind interrupting you to tell you that you're wrong. They have no problem with that. They will tell you and they will give you the correct language to use. And I have found, even with the kids that have gotten to more advanced understanding of this, we can sit down and we can ask them about stuff that we want to talk about. Like, can you educate me about this thing? And they will do that. when we do our updates on our slides for terminology, that's coming directly from our kids. We will go to our kids and say, hey, what word are y'all using for this behavior, this identity? And then they will update us, and stuff has changed over the years. Okay, so now that you got that, that's the base. Everybody's got all of those things. They are not conflatable. We should not be using them interchangeably. The terms that we're hearing about how the kids identify themselves have shifted quite a bit. In the early days of Youth Outlook, most of our kids identified as lesbian, gay, bi, and allies, right? Every once in a while we get kids that weren't sure, maybe the random kid who identified as trans back in the early days. Not so much that you think anymore that we have kids who are identifying themselves as lesbian and gay. It's not that the word is completely gone, it's just kind of fallen out of favor. There have been other words that have arisen and gained popularity that feel truer to the kid's identity and experience. So that tends to be the word that they will use. So every once in a while, we'll still hear a kid identifying as lesbian or gay, but not nearly as much as we did in the early days. We had, for a really long time, we had stopped hearing kids identifying themselves as bisexual. It just fell off the face of the planet. There was probably a stretch of about 10 years that no kids identified as bisexual. And I don't know what caused that, but within the last 18 months, we have seen this resurgence of kids identifying as bi, and almost half of our kids last year, 2022, identified themselves as either bi or pan. So big shift. This wave just came flooding back of kids using that term and feeling comfortable taking that term on. Trans, we are hearing lots of the T word. We used to think if we had one trans kid in our Naperville drop-in center, let's say, and maybe one trans kid in Aurora, and maybe, this is a big maybe a trans kid in our DeKalb drop-in center, we thought we had a lot of trans kids. This is the bulk of the kids that we are serving right now are kids that are questioning their gender identity or have already figured their gender identity out and identifying as trans. So for us, we now have 2 drop-in centers that are specific to trans kids. It's called Transcend. And then in our other drop-in centers, the other 14 of them, we have probably at least half the room identifying on any given night as trans or non-binary. So lots and lots of trans issues, gender identity issues coming up. And we're going to talk about the definitions of these in just a second. So moving through the alphabet soup a little bit further, you've got your Q and your Q, your questioning and your queer, or your queer and your questioning based on the slide. And we do have kids who are using queer comfortably. We have young adults who are using queer comfortably, but it depends on the group and it depends on the kid. So if you do not live within the LGBT community, this may not be your best word to fall back on, but we do have kids who have taken it, reclaimed it, made it comfortable for themselves, and they're using it all over the place. I even now get grant applications and see journal articles about queer youth, queer teenagers. So the word has been reclaimed away from the derogatory meaning that it had 20, 30 years ago. Questioning, we see her questioning a lot. Our agency actually used to be called the Questioning Youth Center, QYC. I haven't seen questioning on literature or heard it used anywhere in over a decade. So we've really moved away from that. Note on that second Q. On the double A's there, the allies and the asexual. We do still hear kids identifying themselves and their friends as allies. So still good on the ally front. And then on the asexual front, we'll get to that. We have a slide on that in just a second. We are hearing more than ever, we are hearing folks identifying themselves as asexual. The I and the 2S for our last 2 terminology pieces, the I for intersex, we have had only a handful of our young folks have known that they carry this, this medical diagnosis. It is a medical term. And most of our kids would not be old enough to have had a reason to go through the testing to find out that they actually have this condition. So I can count on one hand the number of kids. I mean, we've had a couple of young people who have found out after they've kind of graduated out of our group and moved on in life. And then on the 2S front, Only once in 25 years have I heard this term, two-spirit, which is an indigenous term. I heard that from a staff member who was himself from an indigenous family. He stands alone over that entire time. The kids are aware, the young staff are aware. This is a term that unless you have in indigenous history, you are asked not to use this word. It is not appropriate for us to be using it, and our kids are super respectful of that, of not taking on a term that is not meant for us. The whole point of this alphabet soup that we just threw out here is that because language has become so nuanced, we spend a lot of time asking, what does that mean to you? How do you identify? Do you want to identify about anything at all? And asking. The asking part is the piece that's different, because there are an awful lot of folks, especially the folks that we work with in the school systems, who feel like they would be considered intrusive, like it would be rude to ask somebody. And our young people are coming at this from exactly the opposite direction and saying things like, it's more rude for you to assume that you know something about me than it is for you to ask. So please ask. And that's been something, I know the mental health providers that we're working with around here felt a little more comfortable with it, because we do tend to ask more personal questions. As a profession, we do. But when we start working with school personnel who don't tend to ask a lot of personal questions in the classroom, this does come up where like, I don't want to hurt anybody's feelings. I don't want to insult anybody. And our kids are saying really clearly, it is more insulting for you to assume something about it than to ask. Please ask. Take that message out. It's okay to ask the kids. Let's talk a little bit about the newer terms that have popped up. And I said language has become more nuanced. This is the term that we're hearing from the Youth Outlook kids more than any other term. And for the kids who are using it, our drop-in centers, they are doing this in a way that moves us away from how we have prescribed, let's use that word, how we have prescribed how people should move through the world as either male or female. So our kids tend to look at that binary system, that male-female thing, and say, I mean, that works. That's still true. There are males in the world, there are females in the world, but there are all of these people in the middle. And what happens to them? And what happens if I'm attracted to them? What does that mean about me? And how do I identify if I find myself attracted to somebody who is agender or bigender or gender fluid or gender neutral or trans or non-binary? And this word encompasses all of that for them. All right. I'm gonna ask folks to play a game with me, if we could, as we move into the next slide. So get ready, because it's coming. All right. So this is the word you will hear most popularly used, and this is the other one that I said that we were hearing a lot of. And for our kids, it generally means they like companionship and they like having people to spend time with, but they don't feel a high level of need to take a relationship to the next step and become physical. So they just don't have what we would think of as sex drive in the same way that we saw 25 years ago. The comparison for me is 25 years ago, if we had 30 teenagers in the room, that's a lot of hormones to manage 30 teenagers, right? There's a lot of who's dating who and who just broke up with who and who's not talking to who because they dated last week and now they're dating somebody else. There was a lot of that going on. And now we have kids who are like, yeah, there's, you know, we don't really need to have conversations around me becoming a sexual being or safer sex or any of the stuff that comes with a health class, because I don't feel compelled to experience that right now. So we have lots of kids who are identifying as ace. And I have a question about this as things have changed, because it's so drastic, that shift in how things look 25 years ago to how things look right now. I'm wondering two things on the ace topic. Have we always had this number of people who identify as asexual and we just didn't have a word that was commonly used to describe it? Or we know that bodies have changed. we know that kids are hitting puberty much earlier than they used to. In some of the APA studies, we found out that about 7% of young Caucasian girls are developing secondary sex characteristics by about age 7, and about 28% of African American girls are developing secondary sex characteristics about age 7. Those are little tiny people. Those are little second graders. So we know that something is up with hormones. We know that. We already have the testing that shows that. Has there been some shift related to that, or maybe something that's paralleling that has just is causing sex drives to kick in a little bit later or in a different manner? And I would like to see us do a little bit more research on that. I'm not holding my breath that it's going to get done, but I think it's worthy of asking that question, whether or not this has always been the case, or whether or not this is something new that is happening with the changes of bodies that we're seeing. Okay, moving on from there. All right, the T word, the trans group of folks in our Transcend Drop-In Center. Let's talk a little bit about these folks. We have kids who are able to describe very clearly what is going on in my head about my identity does not match what that doctor put on my little birth certificate the day I was born and when I came home. And this kicks in for kids. Understanding gender kicks in for kids really young. We've known this for a while, that in most cases kids understand whether or not to use the binary system, they're male or female, somewhere between the ages of 2 and 3. They got that. We have newer research that's coming out now from the Family Acceptance Project. That's Dr. Caitlin Ryan on the West Coast. And the last time she was in Chicago, she presented her newest findings that said, if we know what we're looking at, and now we do have some inkling what we're looking at because we've had about a decade to look at working with really young trans kids, we can see kids starting to display innate leanings toward clothing and toys and friends they want to spend their time with at about 18 months old. That's a kid that doesn't even have a great grasp of language, but that's just coming out innately. And now that we know what we're looking at, we can start to either get support for a family, we can let that kid develop as their innate drive is sending them. There are a lot more options than we had for kids, say 20 years ago, 50 years ago, where the options that you had were to be a boy or a girl, and this is what a boy looks like, and this is what a girl looks like, and you don't deviate from that. So lots of stuff happening in the provision of service for trans kids, especially the littles right now. And I think there's going to be a greater need in the next decade. We're going to see the lid blow off of. When we talk to our kids about what do you want teachers and mental health providers to know about talking about trans issues, they gave us a wish list, which I thought was really funny. They wanted us to tell you that they were the biggest group pre-COVID. They were the biggest group at Youth Outlook. The other stuff they wanted us to share is when you're talking about this topic, don't put an ED on the end of the word. It's not transgender. Transgender is an adjective. You can't make it past tense. So if we're not using it as a verb, if we're only using it as an adjective, right? I don't lesbian, I don't gay, they don't transgendered. So simply transgender or trans individuals, trans people, a group of trans students. And the other thing that they asked for was, please don't just put an S on the end to signify that it is a group of trans people. It is not used in the plural in that manner. Transgenderism is another one of those words that fell out of favor, kind of went by way of the word homosexual, right? You don't see that anymore. You don't hear that very much anymore. So transgenderism has kind of fallen out of in favor in the same way. So there you go. There's their wish list for how to talk about trans issues for anybody who wants to take that back and share that. This topic. So I said a minute ago, if we had one in one group and one in another group, we thought we had a lot. Stuff has shifted. Coming out age has shifted so much over the last decade. The request for services has shifted so much over the last like 8 years. This actually drove us, that change in age, to add another service to what we were doing. And I think we're going to see more of this across the state. Actually, I think we're going to see it across the country. So right before COVID, we started getting requests for services for kids who were like between 8 and 11. We have a hard minimum age that says 12 is as low as we will go in our drop-in center. And there's a reason for that. In our drop-in center, we're providing HIV prevention information. 12 is the magic age for the state of Illinois at which a kid can walk into any county health department and get HIV counseling and testing without parental consent. So for us, we thought safest to go with what the state has already identified as that age at which this could happen. So we stuck with 12. No kids under 12. Sorry about that. I touched something. So we said no kids under 12, and then we started hearing from lots of moms and dads who were like, but my kid is so lonely. My kid needs something. My kid needs to make friends. My kid is completely isolated. We need something for our kid. And those kids, those calls and those emails for those kids kept getting younger and younger and younger. So we went from my 11-year-old to my 9-year-old to my 7-year-old. And by the time we got through COVID, Youth Outlook was looking at this going, there's nobody else around our area who's going to put together a service for this group of people to do something with this. And we launched our Rainbow Sprouts program, which is now serving kids who are trans and non-binary, who are grade K through grade 6. They've got to come with a family member. Youth Outlook doesn't provide any kind of daycare or physical care for little kids, and they can only access the group. We only run it twice a month. But right now we've got about 15 families who are using it pretty consistently, and they're driving like folks did for our Transcend group in the early days. People are driving great distances to get their kid to this service, so that their kid can make some friends. So I think we're going to see this in terms of other providers being requested to give these services, figure out how to plan them out, figure out how to provide them. We used a group in Austin to base our model off of because they had already done it. We didn't need to create this one. It was already laid out in a manner that we thought we could work with. So there are some groups in the country that are doing this. If anybody's being asked to provide money for this, if anybody's being asked to support this movement of one of your contractors wanting to do a service like this, it does exist, and we are really willing to hold hands to help people get new services up and running to make sure that the kids get what they need, because I think this is going to be a big wave. We saw in terms of the coming out age dropping. Youth Outlook came together to serve teenagers, and we did that for a really long time. And then we started to notice that even our kids, our 16, 17, 18-year-old kids they were like more like 14 and 15. And then the 13-year-olds started to show up. And when the middle schoolers started coming in regularly, we could take a look at this and it's like, oh, right, we saw this drop across the country. If this trend continues, the next group of people who will be coming out are the elementary school kids. And folks, we are there. We are absolutely in the middle of that right now. And unfortunately for the kids, it took a really long time for the high schools to get in on the act and really throw themselves behind. We've got LGBT students, specifically trans students. We need to provide some support. We need to protect them. And not all schools are good on this topic. Not all schools are rushing to make sure that their students are safe. It took an even longer time for the middle schools to get in on this because there's a lot of myth and misinformation out there right now that the kids aren't young, they aren't old enough to know who they are. They're going through a phase. This is something that just needs to be ignored. It's something that the school shouldn't have to deal with. So it took a long time for the middle schools to get on the bandwagon and provide support to their kids. Elementary schools being the next wave, they have a freight train bearing down on them, and they do not have the support to care for these kids. They don't have the training to care for these kids, and they don't have the policies in their schools to make sure these kids are safe. So there's a lot of awareness of that issue among the LGBT service providers, and we're worried about what's going to happen as more and more elementary age kids come out. in settings that are going to be really hostile because I've got some fears for their mental health. All right, now that I have completely depressed everyone, moving on. So we have our non-binary kids, more language. We have lots and lots of kids who identify as non-binaries, and they can shorten it to NBs or NBs as just initials. And this is an umbrella term, and our kids are using this to mean a lot of different things. As I say, the differences are very nuanced. Gender fluid being you move back and forth between genders every day, every couple of hours, every couple of weeks. Whatever time frame is comfortable for you, you may present yourself as more masculine or more feminine or somewhere in the middle. Or you might have somebody who identifies as gender queer, meaning you just don't fit the stereotypical expectations of somebody who is masculine or feminine. I would call it gender bending, is what we would have called it 10 years ago. Just messing with those lines about what's acceptable for males to look like or females to look like or anyone to look like when they leave their house. The non-binary kids for Youth Outlook are the ones that are driving the use of they pronouns, they them pronouns. This is really hard on the schools. This is really hard on the parents. The parents sometimes have a really difficult time with this, that they don't want to use they them. They don't understand why folks would want to be called they them. So we keep putting out the message that when a kid gets to the point of inviting you to use their pronouns and they tell you what they are, it's an invitation, it's a compliment, that they trust you that much, that they expect that you'll respect it. So please do treat it as a compliment, and have your contractors treat it as a compliment. For our staff, we have on occasion had a challenge come up around pronouns, where we've had kids who have wanted to use the pronoun it for themselves, which for my staff was like, wow, that feels so disrespectful for me to call you it, refer to you as it. And we had to sit down with all of those kids one at a time as it came up and talk to them about why they wanted that and how it felt to them to be on the receiving end of it. And all of them had kind of a similar theme running through their information. They wanted to be called it because they had taken it back to reclaim it and take the sting out of it. And people were already referring to them. And for one person, it was like, I'm going to be the best it I can be. And I'm really okay with this. And it felt really odd for us, but we had to enact what we talk about all the time. If this is the pronoun someone's given you, then respect them enough to use what they're telling you that they want you to call them. I don't know that those kids use those for a long period of time. They kind of drifted away from the drop-in centers after a while, and they may not still use them. But when it comes up, we have actually done that. A lot of the messages out there about this being a trend, the kids not being old enough to know, this is not a trend. Non-binary people are not a trend. If anybody on the Zoom is old enough to remember 80s language, we had lots of gender bending musicians in the 80s. Lots of them. People made millions and millions of dollars off of gender bending and playing off stereotypes and moving those lines around and expressing themselves as they were. This is not a new thing. This is kind of timeless. So this is not something that's going to go away. This whole trend moving toward they them is not going to go away. We can only ignore it for so long. So as things have grown and changed, and it's like the more things change, the more things stay the same. That's where we are with language. This has always been around, and we can support it, or we can ask the kids to like live a double life and don't mind that I'm not calling you what you would like to be called, which I don't think is really good for anybody's mental health. So there's the pronouns. We covered that. Let's talk a little bit about transition. We do have some kids who are trans who have started their transition, who live as how they identify. Transitioning is the process by which trans folks, the medical, legal, and social process folks go through to live as what they experience themselves in their heads. Social transition is what most of our kids are experiencing. That's changing their names, sometimes legally, changing their pronouns, changing their hair, changing their clothing. Social transition for folks may mean that you've changed your name, but you're not doing anything medical, so you might still sound the same, It's particularly tricky if you're answering the phone where a trans client is calling for a service. We might do everyone a favor if we move away from the polite terms of ma'am and sir for folks that we haven't met. Because when somebody calls for an appointment, if they haven't started taking the hormone of what they identify as, their voice is going to sound like what they don't identify as. Are folks following with that? Delilah, I got you on my screen. Is that you? Okay, good. So thank you. We're gonna keep moving away from those terminologies. I get called sir all the time. I don't even think my voice is particularly deep, but I get called sir all the time, and I have to stop people, and it's awkward. And this is particularly difficult for folks who have been in the military because they're accustomed to sir and ma'am and those titles of respect. But moving away from them might make safer, more affirming space for folks who are trans and non-binary. Medical transitions for our kids. Some of our kids have already started on puberty blockers. Some of them have started taking the hormone therapy of how they identify. Getting a testosterone shot for our trans men, that is a day to celebrate. The first day they get their first shot, they come in, they want to kick up their heels. This is a great day. They're feeling pretty good when it happens, and they feel like they're finally on their way for their journey. Most of our kids have not had a lot of surgical interventions. For the younger kids, let's put this myth to bed because there's a lot of misinformation out there right now. No doctor, no reputable doctor is doing gender surgery on little kids. None, nowhere. It's not happening. The surgery that teenagers can get to, they have had to jump through so many hoops. Therapy, they have had to be screened by psychologists. They've had to go through testing to see where they are on the Tanner scale. There are so many different things that they have to do to get to the point where a doctor will prescribe them anything, let alone do some kind of surgical intervention. So surgery is rare for the teenage kid. Docs usually, the docs that we are in contact with, our docs tend to like to do surgery if surgery is going to happen for somebody over the age of 18. Bodies are still growing, height, weight is changing. There's a lot of stuff that's going on. So there are a lot of things that have to be considered around any kind of surgical intervention. The youngest kid that we have met who has had top surgery, double mastectomy, was 14 and had been out for several years. So if parents are supportive, if doctors are in approval, all of the stars have to align for there to be any kind of surgical intervention. But the other stuff, puberty blockers, might be used more readily. Hormone therapy might be used more readily. But it's difficult to access. Like for our kids out in the western suburbs, they've got to get in our western suburbs. I'm talking about our groups go all the way to Sterling. We're all the way south into Peoria and LaSalle County and Ottawa. The closest docs they can get who are really educated about this are in Chicago. That's a 3-hour drive, 3-4 hours to get to where they need to get based on traffic to be able to get the kind of hormone care that they need. So there's not a lot of access even to care. That's been a big problem for the trans kids and the trans adults in the area. And then the legal transition piece of this, changing your name, your gender marker on various documents. Those are also big days when kids get to put their real name on their driver's license. So their driver's license is them and not a name that they don't identify with. There's no one way that anybody there's no one way that anybody would transition. People can do social without doing medical. They can do social and legal without doing medical. There are a lot of different options here. It looks different for every client that you're going to talk to. Our most common themes across Youth Outlook time is this decreasing age that we're seeing. And I think we're seeing that from our early conversation before we started the recording. We're seeing this across the state. Decreasing age and questions more around gender exploration than around sexual orientation, and then shifting parental attitudes and education. I wouldn't say that's fully across the state. I see that in pockets, and then the increase of school trainings. So for the gender exploration, I think we're going to start. There was a comment at the beginning that services are now at like 4 times the rate of what they were in the last couple of years. I think that's going to keep happening. What is it with this thing? The other themes that we're seeing for elementary and middle school, we've served kids now as young as 6. That's been super new. We've got providers who are finally keying into the question about what about the mental health implications for kids that are being forced to live in an environment where they have to be what they were identified at birth, not necessarily what they identify as. It's almost like the kid's got a foot in both worlds. What's going to happen when we've got a kid who identifies as transmasculine, who is forced to wear a dress every day and do what parents and community expect of them? And what are the long-range mental health implications of that? We know that there are some that kind of sets our kids up for anxiety. It sets our kids up for depression. It sets our kids up for some school disruption. So there are lots of things that as mental health providers, we want to be aware that we're not doing our kids any favors by forcing them into a role that they don't identify with. The themes have changed for the LGBT providers over this 25 years. Our kids are now between the ages of 12 and 15, not the kids who can drive. And that's steadily dropping across the country. Majority of our kids did not used to be out. And now most of our kids come in with their parents. Their parents drive them and drop them off because they need a way to get to the group. In the beginning, the schools did not want to engage. While we've seen increases in school trainings for the high schools and the middle schools, I am worried about what's going to happen over the next couple of years because there has been an awful lot of pressure on school boards not to deal with this issue, or actually even to be hostile to this issue. So we've got groups of folks who are pushing book bans on anything that's LGBT related. We've got folks that are pushing not teaching anything about intersecting identities. We've got pushes across the country not to say certain words in classrooms. While Illinois is considered a safe state, I would even call us a sanctuary state, even though I haven't heard our governor take on that language. There are some things that I think the mental health community might want to be aware of. There are pipelines forming into Illinois, New York, Minnesota, and probably Washington State at this point. Folks who are leaving the states with hostile policies toward LGBT kids, specifically trans kids. There are families who want out of those states who will be looking to land in the states where it's safe. We're already getting calls and emails for folks who are looking to move because their trans child is no longer safe in their school or in their community. As this happens, and people have already, the first folks through the pipeline have already started landing. The first one landed in Geneva. I think for the mental health providers, we're going to get stretched in a way that we've not been stretched before. As new families arrive who are going to need the services, and some of our already stretched providers are going to be asked to now accommodate these families. I've seen statistics from it's called Erin in the Morning. She does podcast on trans issues. She's talking about 100,000 families moving across the country. There are a lot of people who are going to be on the move over the next couple of years if we do not get these hostile policies under control in the states that are aiming at their trans citizens. And that's going to affect Illinois. Even though we're a sanctuary state, it's going to affect us because we're a sanctuary state. All right, trends across the lifespan. A couple of things to know. Our kids, even in a sanctuary state, we're seeing increasing numbers of harassment. We're seeing increasing numbers of bullying. We've got kids who are reporting having to leave home or leaving home simply because it didn't feel safe to be there. It's about 35% of our kids who describe housing instability, like not knowing if they go home tonight, if they're going to be able to go home tomorrow. Lots of kids plugged in with therapy. Lots of kids from the Illinois Youth Risk Survey, lots of kids considering suicide, more than half of them. When we looked at the numbers for the gay, the lesbian, and the bisexual kids, the bisexual kids were reporting alcohol and drug use at more than twice the rate, almost 3 times the rate as any other group of kids. So this is huge information that just came out, and we looked at that across multiple counties. The other thing that we found in the surveys that just came out is for forever and a day, LGBT people were considered to be like 10% of the population. Okay, maybe 8% of the population, depending on whose study you were looking at. In the most recent Illinois youth risk survey, fully 20% of sophomores and seniors are identifying as LGBT. That's a huge jump, huge, which is gonna change trends. It's gonna change requests for services. It's certainly gonna put pressure on the medical community for more docs to be trained to be able to handle these topics. And that's been an issue already across the state, is that there are not enough docs to be handling LGBT issues. All right, so the healthcare challenges that we're facing. Insurance is definitely an issue because a lot of trans and let's leave it with that one. Trans folks are notoriously underemployed or unemployed for their level of education. But just getting to care in the state, there are no doctors in the community where I live. There are no doctors who are specific to LGBT care. There are a couple of doctors who are friendly and will, they will, not turn you away or treat you roughly, but they haven't been trained in the specifics of LGBT care, and they haven't been trained in how to support a trans or non-binary kid. Unfortunately, there are still homophobic and transphobic practitioners around the state, but a lot of hetero-centered policies around the state in that the one that I think of is something that happened to me a couple of times, is going for a minor procedure where they're going to use some anesthesia and being asked to take a pregnancy test while I'm standing there with my wife, and them not backing down, the clinic not backing down. This is our policy. This is what we have to do. I'm like, clients knowing that they can get a waiver to get out of that would be really helpful. But clinics actually need to start looking at their hetero-centered policies. Not everybody is out there exposing themselves to sperm. So in that manner, et cetera, et cetera, et cetera. We have also been affected disproportionately by what happened in COVID. Because most of us are, most of the trans population that is underemployed or unemployed would be in those frontline positions at risk. So in the retail part, in the essential services part, and then not wanting to seek healthcare because we don't have good experiences and we can't get to friendly docs, also affected us. So lots of healthcare challenges for us. A little bit about discrimination and bullying. High school bullying doesn't go away. Middle school bullying doesn't go away. We are dealing with menacing situations, harassing situations across the state right now. The western suburbs of Chicago is getting special attention from national law enforcement because we are, there is so much chatter about disrupting LGBT organizations, disrupting events, disrupting activities. And that's new within like the last 2 years, where all of this is being directed. It's especially DuPage and Will County right now. School bullying has had an uptick in it in the last 7 years. We saw trends downward for over a decade. Nice little drops every single time survey was released, giving us information about school bullying. And then we saw a huge surge across the country in 2015. This is specific, there is hate crime specifically targeting trans Black women. And we've had 2 murders in Chicago in just the last year of trans Black women. Our kids are paying attention to this information, right? So it's not just that they're experiencing school bullying, they're coming home and they're hearing news about a murder in Chicago. They're hearing news about what's happening in other states. Our kids are, even though they're living within Illinois, they are afraid of what's happening in other states because they're waiting for it to come here. They're waiting for the shoe to drop. Some of us are worried. We're seeing backlash against LGBT organizations. We're seeing protests and vandalism against LGBT buildings. That's a list of just some of the organizations that have been targeted over the last year. I don't know if folks followed the story of Uprising Bakery. They were going to do a drag bingo or a drag like story hour, some kind of drag event. And this place was protested against, demonstrated against for months. The patrons were harassed, the owners were harassed and followed, the staff were harassed and followed home. The owner eventually shut down, I guess right before Pride. That was just finally enough, and she lost her business. She lost her dream because she dared to have a drag bingo or a drag brunch or whatever it was she was doing. Youth Outlook was the first organization in the western suburbs that was harassed by the Proud Boys Christmas time a year and a half ago. And sadly, none of this is new. We have been menaced for decades, starting with the Westboro Baptist Church in the 90s. So none of this is new. What's new right now is that the groups that are harassing us and the groups that are threatening us are very well funded and they're very well armed. And that's terrifying. So Uprising Bakery had its windows smashed out, had its walls graffitied, death threats. There have been numerous death threats aimed at other organizations. Thankfully, we have dodged that. But considering the mental health implications for the folks that are either working in the front lines or even just working at a building or a company that is LGBT friendly and supportive, you're going to come under fire. That cannot be good for our mental health in any way, that going to work to make croissants every day, I have to endure death threats. Healthcare challenges, we talked a little bit about some of them. We still have problems with that culturally sensitive healthcare provider issue. Lack of comprehensive sex ed is starting to shift with the Keeping Youth Safe and Healthy Act, which has been fabulous. We'll hopefully see a couple more shifts over the next couple of years. Our effective disorder rate is still higher, twice as high as our peers still. 2023, here we are, been talking about that for 25 years, and it has not shifted. We're seeing changes in our suicidal ideation that most of us are 3 times more likely than our cishet counterparts to attempt. Unless you are Hispanic and Black youth, that can go up anywhere from 2 to 8 times more likely to attempt. Our housing situation continues to be a problem still. This is another stat I've been saying for 25 years. 40% of the kids on the street every night are LGBT. That's for the kids who are in foster care, we represent 20% of the folks who are in care and detained in juvenile justice. More than 1 in 4 of us are being thrown out of our homes. Still, once we're out on the street, we're at much higher risk for being harmed and being sexually assaulted. And I'm just going to go through a couple more slides and wrap up. So we are not accessing services. Even if we can get to services, even if we can afford to go, we're not accessing services. So care continues to break down for supporting LGBT, especially trans folks, and most especially trans folks of color. What about the docs? There aren't any. There are none to be had. We have absolutely no docs within the largest medical system in DuPage County who are endocrinologists will see trans clients. They will just outright say, we do not have the expertise to do that. So we're all relying on what's happening in Chicago for our healthcare. That's some of the insurance information. Okay. And we've covered this, the use of pronouns and getting kids to places where they are comfortable and have access to appropriate restrooms and locker room facilities. LGBT patients and discrimination. We're seeing lots of discrimination being called out by the Gen Zs. And I don't want it to make it sound like the boomers and the Gen Xers haven't experienced that, but boomers are aging out in such a way that we've lost a lot of the boomer population to just natural death and dying. And Gen X, we lost a lot of folks to HIV. So there are not as many of us around to be making the complaints about discrimination as there are Gen Zs and millennials. All right, location, 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 discrimination and bullying for us is happening in schools, housing, community housing, retirement locations. That one blew me away. The effect of that kind of bullying forces us out of jobs. That's the unemployment and underemployment that I was referencing a couple of slides ago. And once we're unemployed and underemployed, we're talking about inability to get rental housing, inability to do a mortgage, which then threatens our housing status. Okay, couple more things. We are the third ranking group of people in the state. Third ranking group of people for hate crimes. The U.S. In Illinois, we're the second. So those are really dubious honors to have hate crimes being directed at us. Partner violence for LGBT folks doesn't look like what we thought it would either. And this could be its own 1-hour presentation, that trans folks are at higher risk of sexual violence and our youth are at high risk of sexual violence more than we ever thought they were. We always thought that intimate partner violence was not an issue within the LGBT community until this 2015 study came out, and it floored everybody that the numbers were so high. Okay, this was of concern that when we were looking at the abuse and sexual assault statistics, that the age that most women are raped is between 11 and 17 for bisexual. Okay. And then not wanting to be outed or not being able to call law enforcement to get support when something happens, being afraid that we're going to lose kids in the court system, all risks for us being silent and isolating ourselves around intimate partner violence. I'm going to hold here because we're at 9:30. Delilah, you stepping back up? Okay.
Well, not me, Amy Hopper will be going on, but thank you so much for the information.
Yes, thank you. That was fantastic. Jody, do you want me to go ahead and introduce the next speaker? Do we need a stretch for a few minutes?
Yeah, maybe if we had like a 5-minute stretch break before the next, if that's okay with you, Jay. Okay, perfect. Yeah, so let's give everybody like 5 minutes and then we'll regroup if that works.
Okay, sounds great.
Perfect.
Okay, great. So our next speaker is Jay Alvarez. Jay Alvarez is a BIPOC LGBTQ+ licensed social worker whose specialization is in the field of childhood and adolescent therapy, with an emphasis on therapeutic education and treatment for youth and their families. Their passion stems from addressing how trauma interferes with the emotional development of minority youth. They currently work at the Family Recovery Centers, an intensive outpatient program specializing in the dialectical behavioral therapy curriculum. The milieu consists of adolescents struggling with maladaptive coping behaviors like eating disorders, substance use, suicidal ideation, self-injurious behaviors, and their families. So Jay, you can take it away, and thank you for joining us.
No, thank you all for waking up so early to have me here. All right, so let me just share my screen here. All right, so I will preface by saying that I am a little nervous. I am not as like Nancy that's had done this for a very long time, but I'm here with all you. All right, so I wanted to talk about, minority stress and the intersectional influences on the mental health outcomes of BIPOC LGBTQ youth today. So I'm just gonna go ahead and go over some terms that you might be hearing here, just some statistics. the factors influencing adolescent neurodevelopmental health, and then trying to apply that in terms of how that affects the LGBTQ, BIPOC, adolescent and youth population. I will dabble a little bit in like treatment modalities, and if y'all have any questions, if we have any questions, I'll go ahead and address that afterwards. All right, so Nancy went ahead and had quite a few terms. So I'm just gonna go ahead and play on a couple of those. So BIPOC, we're talking about Black individuals, Indigenous, and people of color, which would also include like Latinx people. LGBTQ plus, I did not want to put the whole acronym because it's ever expanding, but I am talking about, you know, the whole community of individuals within my own community. There is a talk about the HPA axis, which is the glands in the brain that connect to our nervous system, our endocrine system, which kind of will be playing in key as they are affected by stress responses. That is very important when I'm to talk about, you know, the population that like Nancy said, you know, faces a lot of discrimination, a lot of just internal and external stimuli that affect the mental health. Minority stress model, it's basically like the single praxis thought that an individual in a minority position has specific predisposition to whether it's trauma, whether it's discrimination, and I will go over some unfortunate statistics. I know that Nancy was starting us off. So from the Trevor Project, we see that 45% of LGBTQ youth consider attempting suicide.
Yeah. Remember all your earbuds for work? No.
Okay. So there's if there is, you know, the resilience factor of familial support, then they're less likely to have such a high rate. When you have an affirming space, whether it's Youth Outlook, whether it's a school that has, you know, GSA programs, or I don't know, there's a variety of different names that, you know, are spaces for allies and people in the community, then there is lower rates of attempting suicide. And individuals that, you know, that were youth that needed therapy because of, you know, the predispositions due to discrimination, due to what's going on in the environment, were not able to receive it either because of accessibility, like Nancy discussed, as well as not being able to find affirming services, so therefore not wanting to go find services. So if we were to talk also about whether you're in a community, there is a discrepancy between, let's say, being in Chicago than being in some small town and rural area, and in terms of resources that might be accessible, and how that would affect the rates of attempts of suicide. So here is just a little table about, you know, the specific, whether it's race, ethnicities, and how, whether they've considered suicide or attempted suicide. And fortunately, you would see that a lot of people of color are very, very likely that once you put it in the whole picture, have the predisposition and have encountered so many different, whether it's trauma, whether it's biological factors that have promoted them to be in a place where they want to attempt or consider suicidality. So we talk about mental health. There is a very extensive history and a lot of studies that have proven the higher rates of anxiety and depression reported among LGBTQ youth especially because we're talking about minority stressors, or even the intersectional experience that I will go into a little later. So some studies, when we try to explain the reasons why there might be LGBTQ issues in terms of mental health, it's because of there's not a lot of preventative measures, not a lot of intervention programs, whether it's to address the mental health of LGBTQ youth, but I would even posit to say that it expands to just mental health in general for adolescents. So some inequities or that are linked to minority stressors, we talk about the stigma, discrimination, not having the effective coping strategies, especially if you are an individual of color that doesn't have that accessibility, or that is in a familial setting that doesn't have the acceptance, or has provided the resiliency factors for adolescents or youth of the BIPOC LGBTQ population. It could also be due to internalized homophobia or transphobia, which can be guided just by the societal experience of, not accepting that you are different from others and not being able to accept that part of yourself because of the fears of coming out. So you're more likely, like Nancy discussed, you're more likely to face dating violence. Like if you are LGBT, it's a difference of 35 versus 8%. Partners of same sex, 21% indicate they have experienced psychological partner violence. Even if you are in same sex relationships, 24% reported physical partner violence if you're in the same sex relationship. And a lot of these numbers can also be very underreported. Just as Nancy discussed, it is very highly unlikely that people of color are feel safe enough to report or call police or go to hospitals to receive treatment for victimization, physical or emotional. So being a sexual minority increases your risk for experiencing physical, sexual, psychological, partner violence. So I'm going to talk a little bit more specifically about adolescent and how that affects the brain. As you know, that when you're an adolescent, there's parts of your brain that are being pruned, whether it's the neural connections that are no longer seem relevant to the brain. And, as you're a child, maybe things as you grow as an adolescent might not be as needed, like I don't know how to play Play-Doh a certain way. So some of that gray matter is being pruned. Some white matter is created, whether it's, we have the creation of, more so of the prefrontal cortex. So we also talk about the imbalance in the limbic system, which is why when I'm in my IOP program, we have a lot of adolescents that are trying to find reward-seeking behavior, even if it isn't the most healthy. So also just because of the new wiring and the reorganization of those pathways, there is, shifts in functioning, and the way that you present yourself, whether it's through body language or even expression. So in adolescence, not talking about LGBTQ populations, but in general, the adolescent population, it's the second leading cause of death from ages 10 to 24, according to a CDC study. So also, if you are, if we talk about, peer pressure, if there is a prospect for reward, a lot of the decisions are more in a reward-seeking manner than trying to think about the consequences of your behavior. So you're more likely to have risky behavior, whether it's trying substances, whether it's I don't know. I had one teenager want to go with a friend to jump off a cliff, not just for fun, like there was water, but they thought that it would be very cool. And, you know, some of the adults were like, wait, what? This is a little crazy, but so the neuroplasticity in teenage brain also makes it more vulnerable, you know, when you do have substances that are like THC, marijuana, you have some other substances that affect, you know, the brain, whether it's at dopamine levels between your connections. It definitely creates a lot of that a more permanent chemical imbalance that is then pervasive throughout their lifetime, as well as the ways that their brain functions because of that. You could see that it's there is an abnormality for adolescents that have you know, been using substances for even a short amount of time, as opposed to adults that have been using for a longer amount of time because of the brain. So when I talked a little bit about minority stress, again, it is a single praxis. So it just, when you see studies, a lot of it is focused on being a sexual minority or being an individual of color, and how that and the pervasive, you know, chronic stressors, whether it's being victimized, whether it's, you know, facing discrimination, prejudice, and not just necessarily like directly, but also it can be indirectly, whether it's through government, through laws, through measures, even minor aggressions like being misgendered in a mental health place or hospital. There's also heightened levels of, you know, mental illness between LGBTQ individuals. There's a lot of studies. I have used quite a bit here. And I wanted to dive a little further and expand that into talking about the intersectional lens. Because when we talk about BIPOC LGBTQ populations, we're not just talking about a single praxis. We're talking about a multiple faceted influences that are being directed towards them and interfere with the physiological stress response processes that are in the brain. So, you know, it's either being a person of color, being someone in a impoverished area, being a trans individual, and even within the community, even within the own community of being in that population, there's a lot of adverse processes going on because of, you know, dysregulation that's going on in your stress responses. So same study that I noted here discussed that when I talked about a little bit of the terms that I wanted to talk about, which is the HPA axis that addresses, you know, we're talking about hormones, we're talking about the neurotransmitters that are firing up. They are affected differently and due to minority stress. So we're talking about having heightened levels of arousal because of the continuous discrimination, or feeling like your fight or flight is constantly accessed, even if it can, you know, even if it's just someone misgendering you or someone bullying you, you have that constant stimuli, which is also not very healthy for the brain and the population that we see even in our milieu is that it's a lot of non-binary trans individuals that then therefore have, you know, issues with hyperarousal. They have anger issues, or they have dissociative issues in terms of needing to injure oneself or not wanting to be here because of feeling either overwhelmed with their experiences, and how that stress regulation is being disrupted in, again, we're talking about the areas, whether it's their hypothalamus, their pituitary gland, or their adrenal glands. So I wanted to address what typically I would, as a mental health professional, would say would be very important in treating LGBTQ individuals. It would be addressing the physiological responses. Like I mentioned a little bit, due to the intersectional experience, there's a lot of rewiring that is being done in the body, and for individuals that are minorities in an array of different ways. It's that rewiring that is not wired the healthiest way. So when we talk about either, being able to self-soothe, a lot of people go into that straight hiding space. So they go into fight, flight, and they're not able to cope in that situation, or to build that resilience to be able to have a good mental health state. It's about being able to then address interpersonal relationships that, we talk about that heightened intimate partner violence, being able to find resources or education on how to have appropriate relationships, as well as ones with boundaries, and, being able to look at those red flags of what is something that as an individual I can control, and for some it's those that are in your environment. Addressing the maladaptive components that we're talking about, which is substance use, which is self-injurious behavior, which is eating disorders, just because for some it is the way that they either receive some control over their own life, or it's the only way they know how to cope. And also trying to incorporate in our own, treatment. Also being aware of the general development that's being done in at the adolescent brain. So what ways that we can address this clinically is by incorporating the competence of, trying to see the intersectional experience, whether it's through, researching specific education, whether it's, expanding your own knowledge, taking some courses that are, like on Prezi, but being able to see not just the individual before you as an adolescent, but seeing the other complex components of who they are, and being able to recognize and address those as well. My location and where I work, we primarily do DBT therapy, and I will basically discuss why I think it's awesome. And I also want to talk about it in an NMT lens. We have Dr. Perry that created just a different way of viewing the brain and how to heal it in the most effective way. So again, like I said, we want to be able to understand how to help most efficiently and have culturally sensitive treatment to accurately represent who it is that we're helping. So being able to also look at the health disparities between the community, whether it's not just being LGBTQ, but also taking into an account the cultural reasons why people don't seek health services. So it's we also talk about how an intersectional perspective can affect an individual, like even if we're talking about individuals in college, whether through your racial status, and how that is plagued by ideas of experiences of heterosexism, depression. But again, the campus engagement, I feel like this is very randomly placed here, but I guess we're just talking about resilience factors and how to build on those resilience factors, especially when you're a marginalized community and as you're developing as a young adult. So what we teach in DBT is mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Like I said, the mindfulness component, I think, is very important when we try to address those physiological components. For like some specific therapies, like I would say CBT, it focuses primarily on the cognitive process and how to address that higher level of functioning in the brain. But it's important to acknowledge, like for some LGBTQ minority populations, already their physiological responses are out of whack, either because of what they have experienced throughout their life or being predisposed to certain conditions because of being a minority of color and having that intergenerational trauma. So it addresses distress tolerance. How do we deal with the hyperarousal state, the dissociative state, how to bring our body back when our first response would be maladaptive coping? And how to emotionally regulate, being able to identify what it is that's going on in your body. That's very difficult for adolescents to do. During that module, we talk about the biosocial theory, which I think is very important when we address the intersectional lens, because we're talking about not just what's going on in your environment, but also what's going on biologically and how it can create that emotional vulnerability within individuals. So making sure not to just create one way of thinking, but how to address the multiple complexities of an individual. And then the interpersonal effectiveness component, which I talked about earlier, in terms of how it's very important to be able to set boundaries, be able to acknowledge who is in your best interest to be around in terms of relationships or friendships, whether that is having to set boundaries with a parent that does not accept you or does not gender you appropriately, how to have conversations in a way where both sides are being heard. So I'm talking when I mentioned Dr. Bruce Perry a little earlier, I wanted to just have you all look at this little brain map. So the way that his theory goes is that as a brain is developing, I would like to try to have you all think about, as an individual of color, as statistically speaking, some of them would be under marginalization, would be under discrimination, might have difficulties in terms of pay gap, those parents, so that once, we have someone in the fetus and the parents are constantly under stressors, the lower level of processes that are being built in the fetal system is therefore being affected. So, for example, heart rate, body temperature, blood pressure, if at that moment it's being developed and you're faced with chronic stressors like cortisol, it affects the brain of the fetus that's inside of you. And therefore, as you're progressing and building those brain and those neural connections, it can interfere with a lot of your own physiological components. So in order to be able to address the whole person, whether it's an adolescent or an adult, is being able to also take into consideration how they were being even developed and what stressors affected them. So I think that it's important to use modalities, which of course my favorite is DBT, because we're talking about those physiological components that are being developed as let's say a baby, and then a child, then eventually an adolescent. We want to be able to address those components before we can even get to the higher process, which is at the very top, which is, the concrete thinking, which is being able to rationally conceptualize the world and what is something that you should be able to do at a developmentally appropriate way. So I just wanted to, if y'all are ever interested in the NMT model, I love Dr. Perry. It gives you just a different way of viewing psychology and how to view, the neural connections of the brain, and therefore also understanding that in order to be able to access the top, layer of our brain and not, our amygdala and the most basic components of the brain, is you have to go as like a tiered process. So that's why I love DBT. Okay, so again, I think I talked about this just now. So it's also being able to acknowledge that for some BIPOC LGBTQ populations, the environment will not change. So what we can do is control how the brain heals, whether that is through mental health treatment, and how do we address those low-tiered biological process before we address, the things that some adolescents need to learn, such as how to find resilience, or how to find, ways to have self-actualization. So again, we want to focus from the bottom up of their physiology. My bad. So something that's also very important is when we talk about studies, resiliency is shown to be the difference, not just in LGBTQ populations, but also in terms of adults that have undergone a lot of trauma. And that is being able to, if you have a protective factor which is just an individual that listens, cares about you, it can make the difference between whether or not you acquire certain mental health conditions or whether you have that resiliency component. So being able to also incorporate that within mental health treatment is very important. And I wanted to go through that fast, just so that, wait, I don't know how to do this. I don't know. Nope, I don't want to do that. Do I just close it? My bad. Okay, there we go. Thank you all. And do y'all have any questions? I know that I spoke a lot. Also, you're amazing too, Nancy. Is there any questions that y'all are curious about? I know that I went through a lot of information. I know that it's also very, very data heavy. All right, well, if there's no questions, or just feel free to ask.
Yeah, if you want to post it in the chat, or feel free to raise your hand or speak up if you have a question. And great job, by the way, Jay. Thank you so much.
No, thank you for having me. I may have been a little nervous about this presentation, but I think it's very important to discuss this matter, and I say that as like me and Nancy have similar experiences of being within the community, and I am a trans person, and I did have struggles and trauma growing up, and I know that eventually. Lynn, you have a question?
No, keep talking. I'm sorry. I don't
Oh,
mean
no, it's okay. I was just saying, it's a very difficult journey, and I wish that I would have had tools accessible as I was growing up. And being able to guide all of you to be able to give these tools to adolescents and youth is very important to me, so that they don't become another statistic of individuals that attempt or that don't survive from attempts. All right. Did you have a question?
I do. Well, it's a comment. Like, I just want to share that it's very hard for me to think past my privileged identities. It really is. It's in spite of, family members and my own historical experiences, it still has to happen right in front of me, or have somebody tell me explicitly when it comes to the particular experiences of intersectionality, and also thank you for making the point that it's so unique to each individual. These are just things I couldn't even imagine. I was having dinner with a friend who's a little bit older than me, a clinical psychologist. She transitioned at such a late age that her 6'6" stature gives her away. She's also Black. We were talking about things like trying to get her nails done and the nail salon, assuming that she's an entertainer, which she's a clinical psychologist. So like just these little things that happen in her life that are continual sources of stress. Meanwhile, someone sent her a drink, and that became like just a terrifying element of our dinner until the people finally came over and introduced themselves and said why they sent her a drink. And I don't think that I could have imagined the kind of stress that a Black trans woman of significant height would experience in public all the time if I hadn't seen it myself. So I really appreciate the work that you're doing and the time that you've given to us to encourage us to understand the mental health costs that are very particular to intersectional identities. So that's all. I didn't really have a question, just a lot of gratitude.
Oh no, thank you. I think if anything, what you shared, it also kind of lets you know, like there's, even if, you know, aggressions, a lot of the aggressions can be very direct and can be very, you know, violent, or there's a lot of microaggressions that can also play into that trauma piece. So I definitely, I will also say that even as a person that's BIPOC, that's LGBTQ, that's trans, I feel like even I have a little more privilege than some trans women that can pass as well as I do. So being able to acknowledge all those little differences are so important.
If I can take a minute to brag. So I have the privilege of working with Nancy for many years, and we were able to support this year an LGBTQIA plus conference at Northern Illinois University. Jay was one of the speakers and was just fantastic. It was really well done, really well attended, and hopefully something that can continue, because it just really, it had a far reach. It had an awesome audience reach. We were able to get CEUs. Nancy was able to get CEUs. And I just think supporting those kind of activities is just really critical, and really proud of Nancy and Jay and the whole group who put together that conference.
Yeah, I think it was this one book that I was listening to, which is Uncomfortable Conversations with the Black Man or something. And I think one thing that he discussed, which would be very important, is immersion. And just being able to hear separate voices and how that important that is to be able to view the world in their eyes. So I think that's really cool. Denise, do you have a question?
I actually just have a comment. So I work in corrections on the side, and that's been a huge topic of conversation there as well. So like Nancy was saying earlier, I mean, they're targeted, right? So even though you want to go with the sex that you identify as, sometimes that's not always the safest setting for that. So just working in corrections on what we're doing to progress in that way that's safe and respectful to both parties. So I will say that Jill has I've been at this one for almost 4 years, and they've really opened up to like, okay, what are our options here? Do you mind talking to them? So yeah, that's been progress. It's been progress. I'm happy for that.
Yeah, it's I feel like it's been a slow process, but it also has been like big jumps. Like I know from Nancy's experience, like going from you know, your being a young adult in the community was definitely different than my experience. And I would like to say that I know Nancy because I used to volunteer when I was in my undergrad. And then I did my internship with Nancy in Youth Outlook. But I would also like to know that I didn't start transitioning until my internship with Nancy because of all these things, because of fears, but also the bravery that the adolescents were going through that, like Gen Z, when Nancy put one of the statistics that they're the most likely to be discriminated or to face certain violences. And it's also because of their authenticity and their want to tackle the world, even if the world is against them. And I think I would just like to give kudos to Gen Z, because you know they're really what is going to be transforming the way we society views them and itself.
I was going to quickly say, and also I worked in corrections for a long time, and just thinking of the trauma that individual has experienced even before coming to corrections, and then all of the trauma they experience at corrections. So officers calling them names, transgender, like that was, you know, they're still even trying to figure out, how do you house someone with transgender? Like, what does this look like? And like they're at, so like, I appreciate all the statistics about like the violence, but then in corrections, they're not safe in any way. So they're sexually assaulted, targeted. And so it's horrifying. But I also really appreciate, Jay, like the physiological component. Like I'm really interested also in like Dr. Perry, and just thinking a lot about like, you know, that brain stem and that trauma reaction, and versus, you know, like we're not always being at our full ability to like function. And I just saw this quote yesterday that says, they never want to discuss what triggered you, just how you reacted. And I thought that that definitely related to this. And so when I was providing services too, it was not to this, like just a specific population, but there was a lot of like, when you react that way, now everyone's looking at that, and like they're not looking at you know, like the actual like what's actually happening. And some people will like purposely trigger you to like to get that reaction. And so I just appreciate a lot of that. And then my last comment too, so I think so Gen Z is like the youngest group, right? And not the greatest with like all those cohorts. Not even really sure what I am, but anyways, I have 2 kids with autism and pretty significant mental health, and my oldest is 15, and just like his experiences and how well like he socializes and has friends, and he's able to say like if someone else at school has autism, like he's like helped them before to like work through that. And so I totally agree with like the youth and how so many of them are, it's like the are not as they're more compassionate and able to like accept people's differences, and it's just very normal to them. And so no pressure on them, but I also have a lot of hope for them to just to be able to like make those changes,
Mary,
those
call
generational
5481.
changes.
Mary, please call 5481.
It looks like we have one additional question from Donna, and she's unable to ask. She's having some technical difficulties, but she's an occupational therapy practitioner, so she's asking this from that standpoint. Neurodevelopmentally, have you ever explored overlap with treatment for sensory processing?
Actually, like, I mean, in terms of in my own practice, no. But during like I took the course, the NMT course, and a lot of when we talk about sensory, you know, whether it's overstimulation or, you know, individuals with ADHD, a lot of there has been correlations in terms of how, you know, during their developmental period they were whether they were predisposed or whether they were exposed to some kind of stressors during that development. So there is in the NMT model, and I know that Dr. Bruce Perry has taken this course out, and a lot of the initial therapeutic approaches have been sensory, have been how do we deal with self-soothing skills? Whether that is suggesting that a parent helps massage their child in order to get parts of those sensory like that sensory input, and trying to create that rewire that connection. So it's really interesting how, yes, you could say that addressing those components of the physiology can play an effect into brain development and further brain development, especially during like key neuroplasticity periods during childhood and adolescence.
Thank you. Any other questions or comments? So we're actually right on schedule. So if we want to take a 5-minute stretch break, and then we'll start again, we'll say 10:30 for our next presentation.
Thank you for having me, everyone.
Thanks, Jay. We really appreciate it.
Okay. Our next speaker is Martesha Brown. Martesha Brown is a Rockford native and MBA graduate of Rockford University with a passion for economic development, strategic planning, marketing, belonging, and community engagement. She is currently the Director of Community Economic Development for Midland State Banks, with previous leadership roles in economic development, public relations, market, and operations for the RACVB, Rockford Park District, and Alpine Bank. She has volunteered on various boards and committees, including Goodwill of Northern Illinois, Think Big, Transform Rockford, Habitat for Humanity, Community Foundation of Northern Illinois, Chairman's Bridge Committee, State of Illinois Governor Pritzker's Capital Development Board, State of Illinois Association of Park Districts, Rebounding Rockford's COVID Recovery Committee, RAVE, Leadership Rockford, Coalition of Latino Leaders, and the NAACP. She has been recognized and awarded as one of Rockford's 40 Under 40, as a Rockford Register Star, People You Should Know, and a recipient of the 25 Black Leaders to Watch by Soul News Network. Inspiring 815, one of Channel 13's 13 Heroes, Juneteenth Helping Hand recipient, YWCA Woman of Achievement, 2021 Rockford Chamber of Commerce Community Hero, and one of the 2022 Northwest Quarterly's 25 Most Interesting People. In April 2021, she was officially elected as the first Black woman to serve on the Rockford Park District Board of Commissioners in its 112th year history, and now sits as the president of the board. Her business, MB Strategic Solutions, focuses on sharing skills and knowledge developed over her professional career in areas of strategic planning, board development, coaching, leadership, execution, belonging strategies, culture, and efficiency building. All right, so we're super excited to hear from Martesha. Thank you for joining us.
No problem. Thank you guys for inviting me. I've been pretty excited about this presentation, I would say, for a couple of reasons. First and foremost, I had the chance to work with the Association of Community Mental Health Authorities. I believe it was last winter, had the chance to work with the organization and learned so much about the great work that's going on and what you guys are doing. So really excited to be able to have this conversation with you guys. One thing that I just wanted to share with you is that as we have this conversation, I want to keep in mind that this is a discussion. You can stop me at any time for questions, comments. We also will have a couple of videos that are included in this presentation. I will give you a heads up that we will not go through all of the videos. However, I wanted to ensure they were in the presentation because you will get a copy of it. And I totally welcome to use it with any future groups that you're working with, any organizations, all the materials and information we're sharing today, you guys will have access to that. So, all right, so we're really going to talk about diversity, equity, inclusion, and belonging. I love to use the acronym DEIB. So if you hear me say that a few times, that's what I'm speaking about. And really want to talk about our ability to provide an environment where those that we engage with, whether it's our co-workers or potentially those that we serve, have the opportunity to really understand what belonging means. And so we're going to cover a couple different topics here. Give me just a quick second. All right, we're going to cover a couple different topics here, but as we're discussing, I want you guys again to keep in mind there's opportunities for us to reflect. We will have the videos and tools available. I would say right now, please grab your pen and paper because we will have a chance for you guys to do a fun activity. And then also additionally with that, just want to give you guys a heads up that there will be a chance for you to win a prize. So I will give a $50 gift card away The only thing you need to be able to be eligible for that prize is to respond, give feedback during this presentation, and then I will pull a name and make sure to email that gift card to you. So chance to win a prize by participating today. All right. So let's go ahead and dig right in. When we're talking about this element of creating allyship or having leadership as it relates to allyship, we're going to break this into 4 categories. I always like to do this because I know people can be at different playing fields when it comes to the belonging space. So what we're going to talk about is first and foremost, a couple of key terms in DEIB, none of those that I think will be fresh and new to you, but maybe a little bit of a refresher. We're going to talk about allyship. We're going to talk about what it means for authentic engagement to get to that sense of belonging. And then I want to talk a little bit more about action steps. So I want to make sure you have something you can take away as it relates to your organizations for creating that sense of belonging. And so we'll go ahead and skip right through these upcoming terms here. All right. So the very first one, I am pretty sure we are all in the loop on what diversity is. I want you guys to consider, however, that when you're thinking about diversity, often what comes to mind for individuals is race, ethnicity. We think about religion, right? We think about gender, sexual orientation. But I want us to make sure that we expand that concept when we really think about diversity. We want to think about diversity of opinion and diversity of lived experiences, which can include some of those elements that we just discussed, but also can be a little bit more expansive. And it really allows us to, I would say, look at individuals and look at people as what I would call a Rubik's Cube. When you're looking at an individual as a Rubik's Cube, you're understanding that there's different aspects of that individual, and you're not just looking at that one side. And give me just a second here, you guys. I'm going to stop sharing my screen for just a moment. I don't know if you guys are you seeing a flash at all on the screen? Okay, all right, then I'll keep on rolling then if you guys aren't seeing that. All right. All right, so when we're looking again, as we're taking into consideration what diversity is, we really want to take the opportunity to expand that concept and really what it means. So next thing I want to talk to you guys about is equity. What exactly is equity and how does that play a role in us being able to be allies? So again, when we think about equity, does anyone want to give a shout or a chance at what the definition of equity would be? And I'm taking names for the prize.
I would say providing people with what they need in order for them to do whatever it is they want to do.
All right, that is a good response. Anyone else want to add to that? Thank you, Amy.
I'd
And
say,
Lynn?
I don't know if you can see me. Being fair and impartial.
Absolutely, being fair and impartial, that is definitely an aspect of it as well. So when we look at equity, what we want to make sure is that we have a good understanding, because sometimes it gets a little mixed up with equality and equity and then justice. And so I want to make sure we have a clear understanding of it. So when we're looking at equity, this is going to refer to fairness and justice, which means that we're recognizing that we all do not start from the very same place. And we have to acknowledge that because we have different lived experiences, as I mentioned before, that we have to acknowledge and make adjustments for those particular imbalances. When we're looking at equality versus equity, you can kind of see a little bit of the difference here. I love this visual component when we're looking at equality versus equity. So equality means everyone's getting the same thing. It is equally distributed, and that means tools, that means assistance, that means resources, the exact same, evenly distributed. When we switch on that element of equity, that's when we move into the point of having custom tools that can identify and address inequalities that are taking place. So we say, okay, wait a second, maybe this particular group that we're focusing in on, whether it is the LGBTQ plus community or the African-American community or possibly the Latino community, maybe we need to adjust the way that we're providing service to this particular group to make sure that it's more equitable. How do we identify why they're unable to get service, or maybe why they're unable to receive the services in the way that we intend to provide? So we want to expand that even more. So now we're looking at equity and justice, because again, I think people get these things mixed up. So we just said, when we're looking at equity, now we've talked about those custom tools. We have identified and we've addressed the inequalities that are taking place. When you move into the justice realm, this is where you're working to fix the system and offer equal access as it relates to tools and opportunities. And that's one of the great things that I love about the organization is when you, as one of the members of the organization, you guys understand that you have the ability to develop a unified statewide voice. You are also initiating and influencing policies, whether it's reforming policies or legislative actions that are going to incorporate and allow for justice. Again, moving from that concept of diversity all the way into being able to provide justice for some of the groups. So again, just a visual component for you guys to see all four of those together. We have inequality. That means that's unequal access. Equality, we're giving it to everyone. Everyone has the opportunity. Both individuals have a ladder, but we notice some have fruit and some don't have access to that fruit. Equity means that now we're going to give additional tools. So you can see where that ladder is being expanded. We need to add some tools to make sure that they're able to provide or receive rather the services that they need. And then justice means how do we really work to fix the solution, fix the problem, and integrate some of those policies. And so just going to go right into inclusion. So when we think about inclusion, again, often we just think about kind of the general ethnicity groups, things of that sort, but we want to expand our thinking and we want to make sure that they are not only included, but we are intentional about making sure that they are not excluded when it comes to inclusion. And so if we look at these three perspectives, diversity is going to be the ways that we differ. We all have differences. Equity means that, okay, we're starting to get to that point where we're like, we want to invite people to the table a little bit. We see that everybody needs to be on the same playing field. And then we move into what I would say is that, excuse me here. Then we will move right into what I would say is inclusion. And that's where everyone has a seat at the table and you're invited to really be a part of the process. I just want to take a quick break and moment to say, is there anything that was enlightening within that piece as it relates to the differences between equity, inclusion, anything that maybe gave you an additional insight on how to view that?
I'll say something. I appreciate kind of the nuance between equity and equality being goal-based, like the end goal, and equity is making sure everyone can get to the end goal. So I do appreciate that perspective.
Absolutely. And I really love to show this example, as I said before, because we sometimes use these terms interchangeably and they are absolutely different. Yes, we absolutely want to get to that point of equity. We want to get to that point of justice. All right. All right. So has anyone heard of the term belonging and can you define it? This is the new, I would say, term as it relates to diversity, equity, and inclusion. What does belonging mean?
That's when we're not just at the table, but we feel like we can contribute at the table.
I love it, Lynn. You are absolutely right. It means that you can actually contribute, and you can contribute because there is now an environment that says, hey, I welcome you and I want you to be able to contribute to this conversation. So when we look at a sense of belonging, it's going to tie in diversity, it's going to tie in equity, it's going to tie in inclusion, all of those elements together. This is where each member is going to be respected. Like you said, Lynn, they can come onto the table and be a part. They're going to be valued. They're going to be cherished. They're going to be able to bring what I would say is their authentic selves. That is such a very key word when we come to belonging, is the word authenticity. I like to always share personal examples as I give presentations and just sharing with you guys what it means as an African-American woman to work in an industry that may not be predominantly minority individuals, maybe not a lot of women that are at that leadership level, but I'm still able to go into the workplace and be my authentic self. That means I don't have to be anyone else than who I am, whether it's the way I talk, the way I speak, the things I wear. As you can see, very bright colors, not your average banker, if you will. I'm able to come to work and be my authentic self. And that means so much to individuals. I have a friend that kind of shared what it feels like to walk into a room and have to change who you are and how much weight you have to carry. Imagine someone doing that for 8 to 10 hours a day. We're thinking about the workday here, right? For 8 to 10 hours a day and having to carry that weight of being someone who they are not. And so that's why this belonging piece is so important. It's where it brings in that element of intentionality, where you're able to include diverse perspectives and talents and values, and it moves away from the concept of what is called tokenism, where you just pick one and they can't be authentically themselves, to making sure that everyone has that sense of belonging. So this is just an example. I like to put it in the form of a party. So if you're going to a party, diversity means you got the invitation, you got the e-blast, you got the invite to be able to go to the party. When we're talking about equity, that means now you're able to attend the party and there's no barriers to enjoy. So if there's accessibility, you are able to get into the party. You don't have any barriers to be able to enjoy that party. Inclusion means you've gotten to the party and your music is playing at the party. You're like, yes, that's my favorite song. I'm so happy to be at this party. When we get into belonging, that means you're welcome to attend the party. And when your music is played, everyone is willing to get up and dance right around and alongside you, and you're not being judged for dancing. So again, a fun example to look at: diversity, equity, and inclusion and belonging, but you can see how it really moves along the spectrum there. So now I want to dig into allyship, and this is really the bulk of our conversation. I think, again, it's always important to make sure we have the same foundation, but let's really now dig into allyship. Now, I will tell you what is extremely important as we're looking at allyship is to ensure that we have a very good understanding of what is privilege. And I had the chance to hop in on the conversation the previous session, and I heard a little bit of conversation surrounding what is privilege. But I do want to share with you guys just a very brief video to give you some examples of what privilege is. We'll go back here.
You can't play. Superman can play.
And one moment on the ad. Sorry about that.
The Scarab is trying to become one with you.
Oh, I forgot how bad it looks.
I seen.
All right, give me just one moment. I am sorry about that. Right, we will share this screen here.
Born into families where they have to walk miles just to get water. All I have to do is turn on a faucet. That's privilege.
If you have ever tried to change your speech, if you were embarrassed about your clothes or house, if you would never think twice about calling the police when trouble occurs.
I think privilege is when some people have some things and other people don't have things.
I feel privilege is something that you don't even really have control over.
I think it'd be silly for me to say I don't have a fair amount of privilege, considering like the country I live in and the job I get to do and the college I was allowed to go to.
I suppose being a white male will help me end up somewhere towards the front, but I'll take a few steps back from being gay.
I don't think I'll make it to the front. I think I'll maybe be in the middle. That's just a gut feeling I have.
If your parents work nights and weekends to support your family, take one step back. If you can show affection for your romantic partner in public without fear of ridicule or violence, take one step forward. If you were embarrassed about your clothes or house while growing up, take one step back. If you have ever been diagnosed as having a physical or mental illness or disability, take one step back. If you have ever been bullied or made fun of based on something you can't change, take one step back. If you get time off for your religious holidays, take one step forward. If you came from a supportive family environment, if you can see a doctor whenever you feel the need, if you are able to move through the world without fear of sexual assault, if you took out loans for your education, if there were more than 50 books in your house growing up. So these are your final positions.
I think it felt kind of strange for everyone.
It's a hard thing to discuss or even reflect on. It was very awkward. I think when you can represent it so visually like this and so immediately, it definitely takes on a new form.
I think we were like all joking around in the beginning. It was pretty lighthearted, and as soon as the questions started coming in, the mood shifted immediately, and we all it was just silent.
Just looking back and seeing like a bunch of people behind you is not a good feeling.
It's like weird how you want to like hold on to explaining a certain privilege, like, oh, but that's not actually me, because like I had to work really hard for that. So it's weird to like take a step forward when you feel like you're taking a step forward with someone else, but you wear a lot of the baggage of like how those things were hard.
It was like more emotional than I thought it would be.
It reminded me of when they talk about slavery in high school and you feel like angry for a few days, but then you just realize like, this is how it is.
For me, it was kind of frustrating almost to look back and see how much further some people were behind me, and realizing that, you know, a lot of that stuff, no amount of hard work or even legislation can make up that gap.
It's interesting being an Asian American because you're not really sure where you fall on the spectrum of privilege.
I know that for me, one of the reasons I ended up so far back was that there are questions around safety as an African American, as a woman, as a gay woman. There are just so many different ways that I don't feel safe.
I feel like I just learned to be grateful for what you have. You know, we're in such a huge society where it's always complaining about what you don't have.
It just shows you that for some families, like each family, you're meant to do better. My grandparents did good, my parents did good, and I'll do even better.
I do think if you're not like aware of privilege, you should do this exercise, but it's more complicated.
All right. So I thought that was something that could provide a very good example on what it means related to having privilege. And I want to take a moment now for us to actually do an activity ourselves to get a better understanding on where we are as it relates to privilege. So I'm going to share my screen here. This is where you're going to want to get out your paper and pen. All right. And so as you see on the screen here, there are a couple different categories, if you will, that speaks to areas where you may have privilege or you may not have privilege. So what I'd like you to do is to go ahead and write down 1 through 12, and you'll say if you have privilege in that area, saying yes, or if you do not see yourself as having privilege in that area, and you'll say no. Again, this is something that you'll be able to keep private with you, so I'm not going to ask everyone to share, but you will be welcome to if you would like to. But let's just take a couple of minutes here to go through these 11, possibly 12 different areas on where you may have privilege and where you may not have privilege. Let's give it about maybe, I'll say 3 minutes to go through that, 3 or 4 minutes. About 3 minutes left.
Oh, the slides went away.
Is it there now? You see it there?
Yep. Yep. Oh, now it's, yep.
You see it there? You see here?
Yes.
There you go. And thank you guys for that. For some reason, the screen's flashing, but I think I got a solution to it now, so we should be good. I'll give it about 2 more minutes. All right, let's give it about 1 minute. All right, about 30 seconds. All right. So let's reflect on that. And again, you don't have to share particularly the areas that you have privilege or the areas that maybe you don't have privilege, but I just want to get some feedback. How did you guys feel while you were completing this? And Deborah, would you like to go first?
Sure. So after seeing that video and then looking at this list, I was realizing I had a lot of emotion during that video. And I have to say right now, I feel privileged. If I look at all of these categories, I feel like I'm in such a good place in terms of what I'm seeing there. But then I think about my past and I think about just various struggles in my life, maybe some physical disabilities. I am Native American and Hispanic background. Although those things didn't affect me drastically, through my life, it still is part of it there. And some things have transpired along those lines at certain times in my life. But I was just thinking last night, just social economic. I just want to give that as an example. I was sitting there and I talked to my husband. I've been to the pharmacy 3 times this week. I went once for my husband and I paid nothing for his medications. I went the second day for my children and paid nothing for their medications. I went to last night to get medication for myself and I paid $1.36. Now I told my husband, I said, how fortunate are we that we can have that kind of health care that a lot of individuals don't have. So just one example of privilege.
No, and Deborah, I appreciate you sharing that. I think that it's a beautiful thing when we're struck by emotion as we're practicing. That means that we're digging even deeper and we're able to put ourselves in the shoes of others to recognize maybe other areas that, again, like areas that they don't have privilege. And then we'll start to kind of think about how can we use some of our privileges to help other individuals. So I saw next Chelsea and then Lynn.
I definitely would second Deborah on that. I was emotional during that video and I've seen that video. I've seen various iterations of that. And I think, a lot of people will assume people have a certain privilege and stuff. Yeah. And we never know what people's burden or baggage, I guess, or experiences that people have gone through. Example in the video, her saying yeah, I stepped forward for this, but it was a really difficult to do that, to accomplish that thing. And I think that, sometimes you are at a very self-actualized, a very accomplished state. That doesn't mean that you're dealing with things that you are not privileged with. And even though you can be at a high level, that means that you're not free from the burden of other things that you might be carrying or identifying. Or also in my case, sometimes I've had projected things on me and people assume stuff. And then I'm like, in actuality, you're assuming incorrect. For me growing up, I had a learning disability and stuff. And I grew up in a time when that was a death sentence. in terms of like, it was, yeah. And so like, it's great to see like the younger generations being able to be more open about that. But like, you know, there's a lot of assumptions and, you know, things that like, I have a lot of other stuff too, but like, that's just an easy example of like, there's people assume like, it's hard for me to like, with dyslexia catching things. And like, so it's really difficult for me times when people tell me stuff and I had to like ask them repeat it a few times. And then they look at me like I'm stupid. And it's like, hey, I just process things differently. And I feel like I have to like out myself. And I've had to come to terms with outing myself to essentially make an excuse to feel like I'm not looked as an idiot in life. So it's, so.
No, I understand that. Thank you for sharing, Chelsea. And I think that's why it's so important that we create this sense of a belonging and allyship, because we all have different, like I said, lived experiences. I know when I went through this project, there were areas that maybe growing up, I did not have a privilege and now I do. And so even life shifts and changes over time. And if we can create this environment of belonging, then regardless of the privilege or the privileges that people don't have, we're creating an environment where it's okay and it's a safe space for you to be you, for you to be you. Lynn, did you want to share as well?
I think Chelsea said it better. So I'll pass. Thank you.
All right. I see Leon there. Leon, would you like to share?
Well, yeah. So thank you for the activity. This is it's kind of eyebrow raising. You know, I went through your list and I thought about initially I didn't think I had much privilege. I just didn't feel that. But then as I went through your list and I started thinking about some of my friends and family members, and I realized, oh my goodness, I do have privilege. But then I realized when I started thinking about some of my my counterparts, my white neighbors and white counterparts, it's like, maybe not so much privilege. So I think there's this thing called the situational privilege that I experience. And it's just interesting. This is a very interesting activity. So that's just my 2 cents.
No, I appreciate that. And that is a beautiful way to think about it, because depending upon the room you're in, that privilege shifts. I think about, you know, as an African-American individual, if I go into a predominantly white environment, that's going to shift my privilege. If I was rather alongside some of my family members and friends that may be part of the African-American or Hispanic population, all of a sudden I have privilege now in this room. And so it changes and it varies, and it's something that can really tie on your emotions, because each room you go into, you now have to kind of adjust as it relates to your privilege. But again, it goes back to that concept of if there is a sense of belonging and you have allyship in that room, regardless of what the room looks like, regardless of the lived experiences, it makes the day just easier. It makes things happen quicker. It tends for more collaboration. So I really appreciate you guys all sharing that. And as I mentioned, that's one of the tools that I wanted to provide to you post-presentation so that you guys can do this with your teams or with family and friends. I think this is a very useful activity for reflection. And so now let's dig in again to allyship. When we get into allyship, what I just want to share is that it is not a one-time thing. It is not a statement or proclamation. So I am a very authentic individual, so you guys are going to get all of Martesha here today. So when I say that statement or proclamation, that is making a statement, for instance, Black Lives Matter, and then there's no additional interaction related to it. Or it is Pride Month, and so we celebrate Pride Month, and then for the rest of the year, we forget about the LGBTQ plus community. These are things that we want to move away from, because allyship is going to take that consistent unlearning and that consistent reevaluation of where you sit at as it relates to your privilege. And we all have privileges, I do too, and the way that we can kind of help to support marginalized groups or groups that are underrepresented. So when you're thinking about what allyship is, I'm going to give you guys again tools. The best practice is, what can we do to ensure that it's something that is sustainable? Again, not just a celebration, but something that's sustainable. And then how do we focus on the group and not the organization? And so it is always good for us to celebrate, if you will, the great things that we're doing, but it's even more important for us to make sure that we acknowledge and celebrate the groups that are from marginalized communities. And so, quote here, it says here, authentic allyship is not about amplifying our own voice. It's not about me. It is about listening, again, listening to the voices of the people within the community. What are they saying and how do we uplift those voices? And so that is what I want us to think about with allyship. It can vary, again, from different ranges on the spectrum, whether you decide that you want to, walk the streets and show support as an ally, or you want to celebrate, for instance, a Pride Month or African American Business Month or whatever it could be. But again, make sure that that voice is being amplified is not your organization's voice, but rather the voice of the community and the group. And how can you uplift that? And so here's the 4 misconceptions, I would say, of allyship. It's performing, platitudes, position, and perfection. So again, these are one of the tools we want to think about. So when we're talking about performing, this is that performative allyship. This is where you loudly profess, I am an ally. But there's no meaningful actions behind that to show that you're supportive. That is what we would consider to be a performative as it relates to a misconception of allyship. So the solution I give you is if you're an organization, what can you do to, again, ensure that there's meaningful actions that are consistent? You can even take this on a personal level, because I think that is extremely important. That means every interaction that you have with that group that you would like to be an ally for, that you are showcasing allyship in every single interaction, and again, not just once. The next thing would be promises made without execution. Now, this is major. I will tell you that, especially, and I speak from, from the African American experience, if there is a promise that is made and it is not executed on, you will lose trust. And quite often in marginalized communities, minority communities, if you don't have that trust, you're not able to be an ally, and that trust is very hard to build back. So it is important that if you make a promise or there's something that you say you're going to do, you have to hold true to that promise. One thing that I think is a useful tool is making sure that you have measurables and you have tracking. So if you say you're going to do something, I'll give you a simple example. There is a board here in the Rockford area that I was a part of. It was the Rave board. They oversaw a couple different entertainment venues, and we made a pledge to our diverse community. After we made that pledge, we were able to set up a scorecard that said, what have we been doing with this particular pledge area? So for example, we want to ensure that our marketing is representative of the population that we serve. So now we can actually start to track that. And on a monthly basis, we can see if we're in the red, the yellow, or the green as it pertains to that promise that we made to our community. So again, it's not just about saying it and celebrating it. Now we're going to move to making sure there's measurables and there's tracking. And that's something that can be done within organizations. The next thing that I will reiterate is position or having a title. So this is where sometimes we give people a position, but we don't give them a voice. That is something we want to stray away from with it when it comes to allyship. So I would encourage that if you are selecting team members or volunteers or employees or board members or committee members, don't just select them because they are a part of that group. Select them for their talents. It's something that I can tell you now, people can see through very, very quickly when they're asked to be a part of something, and it's purely just because of their ethnicity or their sexual orientation. Also, make sure you bring in their talents as it relates to being a part of that committee or group. And then the last thing that I want to say is a misconception is the perfection. And I need us all, and for those I can see on screen, we're going to do it together. We're going to take a deep breath in, and we're going to take one out. No one is perfect in this world. No organization is perfect. And so we have to get to a point where we're no longer fearful of asking questions or moving forward in this space, because we're so focused in on seeking perfection and not wanting to make that mistake. The key takeaway and solution when we think about perfection is that we need to get the right people in the room. We need to make sure we're collaborative. We need to understand that perfection is not the goal, but allyship is the goal. And allyship means you are willing to relearn. You're willing to have conversations. You're willing to make mistakes, and you're willing to adjust. Does that give a little insight there? All right. So this is just a video I plugged in there. We've kind of covered allyship, so we won't watch that video specifically. I did want to share this. I was actually speaking with, I say my sister, we grew up with each other since we were 10 years old on the basketball court. We were enemies, and then we turned to frenemies, and now we're best friends and like family. And I was asking her, what does it mean for allyship for the LGBTQ plus community? We had some great conversations. She actually sent me this video. So I just want to show you guys, this is very, very brief, that speaks a little bit about what allyship is. And hopefully it's all logged in here. There we go.
Ally to LGBTQIA plus youth and their families. I think it starts with listening.
Someone who wants to be an ally but is afraid of doing the wrong thing, it's to ask questions.
Awareness isn't enough in allyship. I think staying silent can be harmful to people who need help.
Some of the misconceptions of allyship is that you just have to not be homophobic, or you just have to not be transphobic. I think for true allyship, you actually have to put your voice out there.
To have an ally in my brothers who grew up actually with a group of friends who threw the word around gay, and they just were like, hey, don't use that word, bro.
There is a massive community of people that are out here that love you and support you and want what's best.
If you lead with your heart, I don't think you can go wrong.
Now, I thought that was a really great video that she sent my way. I just want to get some of your feedback as it relates to conversations even you've had earlier today and what it means for allyship for the LGBTQ plus community.
I would just quickly say that I appreciate the tangibles on like how to be an ally without looking fake, especially like if it's not your goal.
Yeah, no, I agree. And I think, again, we seek that area of perfection. And so we get weary of just asking questions. And that was one of the great takeaways. Her name is Antoinette Hobson. When I talked to Antoinette Hobson, she said, I just wish that people would ask me what it means to be an ally for me versus assuming. Versus being so nervous and being so scared. So again, we sometimes we have to take it to just I would say the humanistic portion of us just being people and wanting to connect. And when you're an ally, you simply want to be able to connect. You simply want to be able to connect. So I will say allyship is a verb. It's what you do. I don't know if you guys recall that quote, but allyship is a verb. It is what you do. So when it comes to allyship, you want to make sure that you educate yourself, that you resist assuming what others need. You practice the art of listening and not listening to respond. We are listening to truly understand and have that empathetic approach on what it means to be an ally. We don't want to put people in boxes, and we want to recognize that the privilege that we have is truly power. And there's ways that you guys can use that privilege to help uplift and, again, amplify the voices of those in underrepresented groups. Again, I would say find ways to impact through structural allyship, and that means getting to that data and then try again. So I just want to very briefly talk about bias, and then there's a couple things we'll do to kind of wrap up our conversation here today. There are two things. There's conscious bias and unconscious bias. Conscious bias is also known as explicit bias. Key things that you want to keep in mind is that this is something that I would say when it comes to unconscious bias, we all do it every single day. There's an example I have here on the screen, and then I'll give you a personal quick example. So unconscious bias would be not inviting a mother to join a committee or not inviting them to learn more about an opportunity to be a part of a board. I'm just not even going to invite them. That conscious bias is you actually making that statement and saying women who are mothers are not serious about their work on this committee. And so we can see how conscious, it's right there, it's in front of you, it's big and it's bold, but that unconscious bias, or sometimes we make decisions and we don't even realize that we're making those decisions, but it may be linked to something that is a bias or predetermined notion that we have about someone. And again, as you guys can see here, when I talk about diversity, there's so much on the spectrum on what we need to consider as it relates to diversity in different lived experiences. I always share a bias that I have, and it's one that I don't think it's one that would be people would see as offensive, but it's something that we do. So I am walking down the street and I'm going to a park when I'm younger, and I see this super tall dude. He's at the park, and I'm thinking to myself, oh, you must play basketball. Like, you are tall, you're athletic, you play basketball. Let's go play some basketball. And he's like, no, I don't play. So I just looked at you and I had the vision, because you fit into a box or into characteristics, I assumed that you would play basketball, and that's not necessarily the case. So you can see how sometimes we have unconscious bias that are not even necessarily something that is intended to be offensive, but we do it because that is the way that our brain operates. We just naturally put people into boxes, and we have to work hard to pull people out of those boxes and get to know each individual person. So I do want to show this video here. I will tell you that this is an example of bias, and I want you guys to look at it from both angles, not just from the individuals that he's interacting with, but how he interacts with individuals as well.
All rise.
All right. So what were your thoughts with that video?
I am crying.
Oh. Yeah. You know, it makes you think about, again, the lived experiences that individuals have. And you can see the bias from both standpoints and both viewpoints. I think about, again, family members that may go into stores and they automatically think someone's following them because they believe I'm African American and someone's following me, all the way to the reverse end of someone actually following them. Again, these are true lived experiences. Lynn?
That was actually where my head went, like just a long time ago, taking my daughter and her friend to the mall, and her friend was 18 and a thin Black man. He had never been to the mall, and people were following us the whole time. And I thought, wow, no wonder, you know, like for all the reasons that he doesn't go to the mall, that's a good one. But it was, you know, like I have heard that before, but it was very different to experience it, to be tailed the entire time we were there. So yeah.
It's so interesting. And one of the things that I want to talk about, Lynn, here next, that I think will kind of help to emphasize this, and I'm just going to skip ahead to some of these things here, is really looking at microaggressions. So when you're experiencing those are microaggressions. And this is a video that I want to share with you guys. And I really want your thoughts surrounding this. And hopefully this will help you to understand the connection between the mental wellness and the mental health of individuals who may be experiencing microaggressions and why it's so important for that sense of belonging. I will tell you there are because these are things that we're talking about are very emotional. This is in no way, shape, or form intended to be offensive, but again, just a perspective of what microaggressions mean and how it impacts. So let's go ahead and watch this short video here.
For people who still don't think that microaggressions are a problem.
Oh, you're so well spoken.
Just imagine, instead of being a stupid comment, a microaggression is a mosquito bite.
Ugh, it's a compliment.
Mosquito bites and their itch are one of nature's most annoying features. But if you're only bitten every once in a while...
No, where are you really from?
Cleveland?
Sure, it's annoying, but it's not that big a deal. The problem is that some people get bitten by mosquitoes a lot more than other people. I mean, a lot more. Whether it's on a date...
Oh, your English is so good.
Excuse me?
Going grocery shopping.
You know, everything happens for a reason.
I'm just buying apples.
Commuting to work.
So when are you gonna have a baby?
Watching TV.
We have to keep the Redskins' name. It's part of our culture and history.
Or just walking down the street with your partner.
I couldn't even tell you were gay.
Mosquitoes seem to pop up everywhere.
Do you know John? Give me shopping advice. I love Cher too.
And getting bit by mosquitoes every day.
Can I touch your hair?
Multiple times a day.
So pretty. Can
I touch it,
hair?
please? Can I please?
Is annoying. And makes you want to go ballistic on those mosquitoes. Which seems like a huge overreaction to people who only get bit every once in a while.
It's just a mosquito bite. Who cares? Just another angry black woman.
Of course, beyond just being annoying, some mosquitoes carry truly threatening diseases that can mess up your life for years.
Astrophysics? Maybe you should try this challenging major.
Ow, my dreams.
And other mosquitoes carry strains that can even kill you.
He looked like he was up to trouble, okay? I felt threatened.
So next time you think someone's overreacting, just remember, some people experience mosquito bites all the time.
You're all so exotic, wow.
And by mosquito bites, we mean microaggressions.
All right, so what were your thoughts on that video?
I think it gives it kind of a tangible way of like, it's that extra piling on, you know, they like people, oh, it's just one comment. They only see that one, you know, opportunity. Like example would be like, oh, when are you going to have a baby? Like, you know, we all experience those all the time. But like, it's just when it's piling on and you can't say to someone else like, oh, just get over it. You know, if someone makes a comment like that's homophobic or just really not, you know, aware, and like you make it and you call it out, people are like, oh, it's no big deal. I'm like, but yeah, like that adds up. Like that behavior is not okay.
Yeah, absolutely. And that's the way to look at it. Like you said, Chelsea, it starts to add up. And again, not intended, we all get our mosquito bites for the day. I mean, you said it, and you probably saw me do the hallelujah hand raise of when are the kids coming? When are you going to get it? You know, those types of things start to weigh on you. And if you go through that throughout the day, that weighs on your mental capacity, whether that's in the workplace or your ability to just be open with others because you don't want to be too open. Maybe someone you will experience a microaggression as a result of that. And so again, that is why it is so very important for us to make sure that we have a sense of belonging in our environment. So a couple things that I want you guys to think about when you're looking at unconscious bias for your authentic leader or your authentic allyship. Pay attention to your thoughts. There's nothing wrong with taking a look in the mirror and saying, man, you know, maybe I didn't intend to say that, or maybe I wonder if I should just ask them and just make sure I get clarity. I did not intend. I apologize. How can I be an ally? And then also slow down and investigate your why. So what I'm starting to do is before I make a decision, before I kind of blow up, I say, wait a second. What about your lived experience? What about what's happened today is impacting your ability to make a decision right now, or to make I would say, a decision that is not based upon some bias that you may have. So again, that is a tool that I would definitely say that you want to look into. So when we think about authentic engagement, authentic allyship, is going to take that vulnerability. It's going to take transparency, and it is going to take integrity. Integrity to me is another way of saying consistency when no one is looking. So it's going to take that level of integrity. It's going to require you to have a willingness to proactively create opportunities for active listening that also allows for feedback so that you can ensure that, again, you are being that great ally. It's going to require you to foster ways or to find ways to foster trust. And that means that you're going to have to engage in audiences and groups or individuals that you don't normally communicate with, because that is what it's going to take to be able to gain that level and that perspective. Again, ways that you can do that. You want to look at focus groups, survey, just get connected with someone. Go out for coffee. I say at least once a month, I try to go out for coffee with someone that I don't know, that maybe someone wanted to introduce me to, or just someone I met while I was out and about. And I try to grab coffee and just get to know individuals. So again, it's about opening and exposing yourself to different communities and having what I would say is that authentic engagement and building that relationship. So as we move into this area of belonging, I did throw in a couple of videos in here for you guys to be able to take a look at, but we kind of chatted through some of these pieces. So I just want to reiterate some of these areas. When we are looking to create a sense of belonging, we want to make sure that we're having open feedback. You guys have heard that a couple times, that we're listening. We are prioritizing connection over response. I also encourage that your organizations, your board, anyone that has a touch point with clients or a touch point with those that you serve, they absolutely need to go through diversity training. It's not about, I've gone through it before. That's something that consistently needs to happen within organizations, and even for you personally, if the organization does not provide it. And then also, I would say what's important is for you to do the internal work, whether that's as an organization or as an individual. You create a plan. You create a strategy. You explain what DEIB and allyship means to you, or what it means to your organization. If you're looking to do that, and you're looking to make sure that you're creating a statement and a plan, as I've said before, make sure you have a timeline. How are you going to measure what DEIB looks like? How will you update this internally or externally? Don't let it be a plan that you build and you say, yeah, we got a plan, and then it goes on the shelf and it collects dust. That binder that we all have. We have at least one of those in our office, right? Everybody has that one binder. One other thing that I want to emphasize or give you as a tool that could be a takeaway for today would be creating what is called a DEIB shared vision. So that's the diversity, equity, inclusion, and belonging shared vision. And it is simply a statement that will talk about your thoughts where it relates to workplace culture, thoughts on your board and your volunteers culture, and even thoughts on service to others, or what you will personally do to make sure that you are an ally as it relates to diversity, equity, inclusion, and belonging. And so today, we've talked about a few things. We've talked about key terms in DEIB. We talked about allyship. We talked about authentic engagement. We talked about belonging, and even some of those tools that you can do to make sure that it's measurable belonging. And so I want to leave you guys just with a couple of thoughts, as I kind of talked a little bit about one of my best friends, Annie Hobson, and I said, what does it mean to you as an African-American woman that's part of the LGBTQ plus community? What does it mean to you with allyship? What would you encourage that people do? She said, widen your understanding of terms and pronouns, stay informed, speak up. And we've said that before. Speak up when you hear terms that are being used, or when you notice microaggressions. Speak up. You can see it. You now have a viewpoint to understand it. Be open to learning what you don't know, what you don't understand. Greet and engage with members of communities that you serve that don't look like you or don't have the same lived experiences. Be bold and state your allyship. That means so much. And it's not just about being performative, but standing your ground. She tells me how it's so important as she goes out of town for her and her partner to go to a restaurant, and they see the pride flag outside of the restaurant. She says, I know I belong here, not only because, I know there's laws against people doing certain things, but I know they're intentional about ensuring that I belong. Do not be fearful of simply asking how you can support and how you can grow in your allyship. And that is how you get to authentic allyship. So I thank you guys so much for being able to spend the time. I know this was a lot of information within the hour's time, but so appreciative. And I open it up. I know we just have a few minutes here, but I do open it up if there's any questions, as well as my contact information is there. I'm just a phone call and an email away, you guys. You can always reach out. Thank you, guys.
Awesome job, Martesha. It was wonderful. Thank you so much.
Yeah. So, thank you, guys.
Anybody have any questions? Feel free to speak up or post in the chat.
Great.
I agree with Debbie. Thank you so much.
So
Thank
Martesha, if we get slides, will the slides have the videos in it?
Yep, the slides. What I'll do is I'll give you a link to the Canva presentation so that you'll be able to use the slides. You can use them in the future, watch the videos, all that jazz. I'll even give you a one-sheeter of the activity that we had too. So I'll email that your way, Jody, here in just a little bit.
Awesome. Those are wonderful. The
Yay.
visuals always help seeing that.
No problem. And I will be sure I will check and select the name. So be on the lookout for Jody's email because the winner will be included in the email there.
Awesome. What a way to end the week.
There you go.
All right. Well, I guess there's no other questions. So thank you so
I
much.
just had
Oh, I'm sorry. Did somebody have?
Yeah, I just had a comment. Just highly informative and timely. These are things that we just do not talk about enough.
Yeah.
But I also had just a comment about the list that we went through, and all the videos were just, I mean, they were very powerful. But I did have a little bit of difficulty in determining what was, for me, what was real and perceiving.
Yeah.
Because imagination can be far more powerful than reality, if you know what I mean. So,
yeah.
But very, very well done. And thank you. Thank you.
No problem. I appreciate that feedback and that comment. And I will send the videos. And if you have any other ideas, you guys, I am always, just like I said, feedback when it comes to allyship. If there's any feedback you guys can give me, I welcome it. And I really would appreciate it.
Wonderful.
I just wanted to say something, Jody, if I could. Such excellent presentations today, all three of them, and this one was exemplary as well. My question is, we do a lot of work with juvenile justice, and like a fourth of the work that we're looking at doing is really around EDI. And just wondered if you guys are open to travel or presentations in other areas, because we definitely wanted to do some training, and I think these would be excellent trainings for our group.
Yeah, I'm more than happy to. I can't speak for the other presenters. I'm sure they would as well. But yeah, more than happy to. I will make sure that Jody has my contact information so that we can connect.
Thank you.
Well, it's a pleasure working with you again, Martesha.
Thank you.
Like Chelsea had pointed out, you were the mastermind with our branding, so appreciate it. It's been wonderful experience again. So thank you so much.
Awesome. Thank you, guys. I'll see you guys soon. I would say see you soon.
Have a good weekend.
Thank you.
Everybody. Thanks so much for joining us.
Bye.